you can't take an antidepressant and estrogen. That is a myth. And would you speak about that?
No question a myth. Now, why is that important to talk about, though? Because depression's a real important issue. And if you look at women who have a previous history of a depressive episode, and that includes like PMDD, premenstrual dysphoric disorder, postpartum depression, those particularly reproductive related depressions, that those women are about a threefold increased risk of getting depression as they go through menopause. Okay. Now, of course, with depression and menopause, it's hard to say because, again, we talked about sleep being miserable. And if somebody's not sleeping well, do they tend to get more depressed? Yeah, they probably do. I mean, that's probably going on. But we do know, and this is some interesting data, that if you have a woman who is a menopausal or perimenopausal woman, and she's getting depressed, yes, of course, you can give her an SSRI, SNRI, but some of these people will not respond to the therapy. However, there is some data out there that shows if you then give these women some estrogen to take as well as the antidepressant, it sort of, in a sense, primes the pump and they will respond much. So there are women who are refractory to antidepressant therapy that if you give them a little bit of estrogen with it, will respond much better.
Thank you for that. And again, I'm reminded of my recent occasion to speak to this group of women who many of them voiced that they were offered an antidepressant and offered menopause hormonal treatment. And they were kind of like, this is too much. This is this is all negative, negative, negative. Mm-hmm. And the little that I understood, you just so eloquently laid out for us, which is that there's a fit there. Yeah. And priming the pump is one. And then kind of drilling down deeper is what can turn the tide for so many.
Yeah. And we also discussed the fact that, one thing I should bring an ancillary to that. Mm-hmm. There are other therapies for hot flashes besides estrogen therapy. And we should probably talk a little bit about that there are other therapies out there. And one of them that's been recognized for years is actually SSRI and SNRI antidepressants. So, for example, if somebody has a little touch of depression, okay, and they're feeling depressed for whatever reason, and you were thinking about, and they were also having hot flashes, that it is quite reasonable to prescribe an SSRI or SNRI, which may help with both. May help with her hot flashes and with her mood. So if somebody is, and again, I try to, when somebody comes in, I've got hot flashes, and like, what's the right therapy for her? I try to go through everything, say that these are your options, this is your choice, stuff like that. And then to try to narrow it down. And if she says, well, she's got some depressive issues, yes, I might say, let's try estrogen as well, because that might help an antidepressant. But certainly if she's really having anxieties about estrogen, which exist, I mean, people, again, have this, feeling, oh my God, this is not safe for me to take. If she's anxious about it, then we can always give her an SSRI or SNRI, and it might well work for her, for both.
Thank